Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about direct primary care versus concierge primary care. I had to do a little bit of research on this because I knew that there was a difference between the two, but I wasn't quite sure exactly what all the differences were. And I did a recording of a video about Amazon and their involvement in healthcare, and that's why this came up, because they have a hybrid model that they participate in that's between the two of the direct primary care and concierge care. And so I was like, oh, I should probably do a video about those just to let people know that there's different options out there for primary care other than the traditional choose your primary care, go to the doctor, have them bill your insurance, and you're done. A lot of primary care doctors are retiring. Other new doctors and mid-levels coming out of school are not wanting or choosing to go into primary care. So there is definitely a need for more providers in primary care. And because of this, it's causing a very large backlog of patients at existing primary care offices where it's just not possible to be able to offer those same day appointments like you used to be able to do back in the day. You also, it's very hard to get a call back the same day if you have a question that you need to ask an advice nurse about. And a lot of people are frustrated about it. So we have people out there trying to find resolutions to this and how to fill in those gaps until more providers hopefully will participate in primary care. The other reason is, about 10, 15 years ago, so many people left private primary care offices, or they closed their primary care office and they joined larger entities. And when that happened, it pushed all their patients over to these entities, and that also caused the backlog, right? So you have multiple factors that are going into this very busy, high patient population volume primary care clinics. And now we're starting to see that pendulum swing back to private primary care groups, like private small, like a few doctors maybe in a practice, or maybe groups of primary care doctors coming together and opening multiple locations. That is definitely starting. But in the meantime, it's like, how do we fill in those gaps? So a lot of people have come up with direct primary care options or concierge primary care options. Direct primary care is a membership-based plan model where each individual pays a certain amount of money for themselves. So each person has to pay every month or quarter or annually if you want, but usually it's on a monthly terms and it's month to month, so it can be canceled anytime. And that includes all of your primary care needs. And I shouldn't say all because it might not cover some things, but it covers the majority of primary care needs. So office visits, lab tests, imaging, okay? They don't bill insurance. So whatever you're paying every month for that specific service for each person covers all of this. So it's kind of a gamble, right? Like you might go all year paying this and you don't ever need to go to the doctor except for maybe your wellness exam and get your vaccines and some blood work. But then you might have a year where you pay the same amount, but you are sick a lot. And then in that case, the direct primary care might lose some money. So it's a gamble for both sides because you have the doctors, the mid-levels that are offering this care at a certain price, assuming an average use, right? They've figured out this cost based on patient's age, how much their services would charge, their supplies, the deals they have with the labs, the diagnostic imaging, etc. And they come up with these prices. And so either they're going to make money or they're going to lose money depending on how the patient's health is in any given year or month. They don't bill insurance, but a lot of times they still encourage patients to have like a high deductible plan, because if the patient were to go to the ER or need to go to an urgent care because they're not available for some reason, or God forbid there was a terrible accident, something like that, the prices you're paying to this primary care entity does not cover any of that. So it would be all out of pocket, because this is just a membership agreement with this specific group, this specific person or practice. So a high deductible plan is definitely encouraged in this situation because of things that are out of our control that could happen that make you go to other entities. Same if they need to refer you to a specialist, right? Something's going on and you have to see a cardiologist, a urologist, a dermatologist. That wouldn't be covered either, because it's not that entity that you have the membership with. So that is one of the downsides. The upside to direct primary care is same day appointments. You have really fast access to your providers. There's usually like a 24/7 virtual care that will help. So if you need them, it's available. A lot of new parents like this because, for pediatrics, because if their baby, they're not sure what's going on, they have somebody they can call, especially if it's a more nervous parent, this might be beneficial for them. Some of the other benefits of the direct primary care is they could do maybe house calls depending on the doctor or the mid-levels and their preference. There's no administrative burden, so they are able to keep their costs down because they're not billing insurances, so they don't have to pay for some of those employees that they would otherwise have to employ for the billing and the coding and working all of that. And they don't have to worry about the administrative burden for themselves either. Sometimes they're able to have medications that are included, like basic, maybe like hypertensive medications, diabetic medications, antibiotics, something like that. But then for others, you might have to use your insurance or pay out of pocket at the pharmacy for those. So there are definitely some things to consider if you want to offer this to patients as a provider, as a manager, of thinking about all of the stuff, right? You need to make sure that you understand your costs very well and how you're going to do those membership plans and how you're going to offer that. It's definitely something that should not be a fast decision. It needs to be weighed out. It needs to be considered. You need to do all of the budgeting and the financial analysis to understand if you can make that model work in the area that you practice, both geographically and specialty. But usually it's just primary care because it's way more controlled than other specialties, and those usually cost more anyway, right? But I'm talking about like if you focus on like only adults, or if you do peds and adults, stuff like that. I did read that if a patient has a high deductible insurance plan, that they are not able to put money away out of their elected or elect to have money put away from their checks in their HSA account for this, because although it is recognized by the Affordable Care Act, which isn't a huge factor anymore, it still doesn't allow you to take money out, even though your employer can contribute still because you have the high deductible health plan and they can contribute towards that. There was something about the employee's contribution, and that could have changed by now. I didn't understand all of it. So if you are a patient watching, or if you're a provider considering this, you might want to look into this a little bit further just to be able to help provide the information either to patients that might have the high deductible health plan and how the HSA, the health savings account, plays into it. And also, if you're a patient, of course, you would want to know before you elect to do any of this. The nice thing too is that because there's no administrative burden and it's usually a less patient volume that this practice has, the appointments are longer with the providers. So they can do 30, 40-minute appointments instead of 15 minutes, like roll them out, right? So that is something nice too, especially for the providers that want to take the time and have conversations with their patients. And in this way, you also get to know your patients better on a personal level, which I know is one of the biggest complaints from people who remember old school medicine versus new nowadays medicine, is they don't have that solid feeling relationship with the provider that they see. And I feel that's very important, especially in primary care, because people are more likely to go to a doctor that they feel comfortable with or a provider they feel more comfortable with. So anyway, that's direct primary care. Concierge primary care is a little different. It's also called boutique medicine. And this usually is also a membership-based plan. It's an annual cost. So it's like a contracted annual year-to-year type thing, where direct primary care is often month to month and it costs less. Where this concierge, this is usually for people who have a little bit more money and they want to be able to have direct access to their provider at all times. So that's why it's called concierge boutique medicine. And these people still have insurance, and concierge PCPs do still bill the patient's insurance, unlike direct primary care, but there's a membership that you have to pay in order to be part of this on top of your insurance. And it doesn't cover any of the services that you receive other than just knowing that you have direct care, direct contact, direct phone numbers to that provider at all times, no matter what. So you're paying for that luxury, for that direct access. And again, this is something that not a lot of people can afford. You can't cancel it like mid-contract. It's usually annually, so it's year to year. And it's something that a lot of people usually can't afford. So it's mostly for people who have more money that can afford insurance and this special boutique medicine. Again, they have direct contact phone numbers to their provider who is guaranteed to answer at all times. So this is definitely going to be holding the primary care provider very accountable from these people. They expect things to be taken care of when they need it to be. And so the provider is basically dedicated to their patients full time. There isn't really a break. And unless you can partner with other people in the same practice that you guys can cover for one another and let your patients know that you need to take a break once in a while, or you're allowed a vacation or a weekend or whatever, but somebody else will be covering for you, then that's how you would most likely probably make it work, because somebody has to be available for direct contact at all times. Because of this direct interaction and care, they're more likely to be like hands-on with coordinating with specialists, admitting to hospitals when needed. They're like directly involved instead of just making a phone call and saying, hey, my patient's coming, and the hospital takes care of it, or the specialist office. Like, they're actually in there help facilitating and communicating. So it's almost like a personal doctor that you've hired, but they do it for multiple people, multiple patients at once, not just you. It is not recognized by the Affordable Care Act as like a non-insurance option. So not that the Affordable Care Act is really a factor in things as much anymore, but that is something to consider. It is something that, could be used with your HSA, because you would have insurance. They do bill insurance. So even though the membership wouldn't be considered like an HSA or FSA expense, at least they bill your insurance so you could utilize everything that you have set up for your high deductible health plan. That is a bonus. Also, because of the direct contact, the direct access to the provider, they're going to have a lot less patients. And the provider is going to be getting more income because they're going to get paid by the insurance plan for the services they render, but they're also getting this membership fee, this membership amount that patients pay. So it's supplementing that income for not having as many patients, but still being able to live a life and make money by offering this option of concierge primary care. And usually providers who do this don't have like a clinic other than for these elite people that pay for the membership. Like, it's a club only type thing. It's not like they have their own like generating income with regular patients and then have this on the side. I mean, they might, but that would be trying to juggle that. I couldn't imagine. So most likely it's going to be something very private, very small. And because of that membership fee and then billing insurances, that's how they supplement their income to make up for the less patient volume. So the difference between direct primary care is that pays for like that membership fee pays for a lot of services at the doctor's offices, and they don't bill insurances on your behalf. And then you have the concierge boutique medicine, where it's a membership fee to be in like this club, but they also bill insurances for services rendered. And it's more involved, it's a little bit smaller. So hopefully you kind of understand that. The nice thing about both of them is that they are recognized and able to have employers apply for a health reimbursement arrangement or an HRA. So um, that basically allows employers to reimburse their employees tax-free for qualified medical costs. And that is nice, because if employers wanted to bring these on as a benefit to their employees for whatever reason, as an extra additional benefit, they can. If they want to help maybe their employees pay for a direct primary care membership, or put money towards a concierge, or maybe they have a doctor that is just contracted to work with their employees, so they pay that concierge annual membership. That's a benefit for employers if they can afford to do that for their employees. So anyway, it helps them qualify for that. So that's a good thing. But again, because primary care does need providers, and because a lot of patients complain about not being able to get quick access to their primary care, this is what has come and developed and been kind of developing over the last 15 years, as doctors were leaving and going to bigger entities and causing people to not really like being in like the business type of medicine healthcare systems. This is what has come out of it. So we can thank that pendulum swing for this. But I mean, it's out there, and I do know some people that participated, and it works really well for them as providers. Usually it's the direct primary care that I know about. I know a few providers in a smaller town in Oregon that do this. They're very successful. The patients are very satisfied, and they get really good care. So it is possible to make it work and be successful. It's just really making sure that it's the right fit for you as a provider, a manager helping the provider understand this, doing the financial analysis, and understanding all of the money that goes in and out to make sure it's worth your while and that you charge enough to pay your bills and then make an income. So anyway, if you have any experience either as a patient being part of one of these types of situations, or you're a provider that offers either direct primary care or concierge care, I would love to hear from you. So please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with anybody whom you feel would benefit. Thank you so much, everyone. We'll see you next time. Bye-bye.